So FCS, or familial chylomicronemia syndrome, is usually something that presents when people are kids. So often it's little kids or adolescents may present with a long series of episodes of abdominal pain. And so one of the difficulties is this is often misdiagnosed, and patients may not be diagnosed until much later in life, in fact. And so often these patients will have other diagnoses that may or may not be correct. And many of them are quite frustrated by the time that they actually do get a diagnosis. There are also some other manifestations that people sometimes get. They might get a skin condition where they have essentially red spots on various parts of the body that often dermatologists end up discovering the diagnosis. And sometimes there's some other more difficult symptoms to diagnose. If an eye exam is done, there are sometimes some findings that an ophthalmologist may be aware of. But the difficulty with this is it's symptoms that are sometimes hard to recognize, and it's more the pattern of the symptoms more than the symptoms themselves that are the tip-off. And because we often aren't doing triglyceride levels or any kind of lipid levels in children, it's often not found by the typical lab findings either.